Hi everyone, welcome to a new Begijnhoeve video. My name is Tommy, and if you're wondering why I am having a skull in front of me, it's because we're going to have a very interesting subject today. We're going to talk about equine dentistry. Do I say that right?
You say that right.
Okay, so you might recognize her from the previous video because she also do the bit fitting. I have Christy.
Hi.
And your specialism is?
Dentistry, equine dentistry. So my focus is equine dentistry. That's also why I was really interested also in bits and bridles. But my main job is dentistry, and that's also where my passion is. So yeah, we work together in a team with more dentists who are also veterinarians. And I brought one of my team members, Michael. So today we will show you some dental information.
Dental information, that sounds really good. So, and yeah, you already said your team member Michael.
Yes.
Welcome.
Thank you.
So,
my name is Michael. I work with Christy in a team now for 4 years as an equine vet with focus on the dentistry. And I'm glad to share some information with you today.
Cool.
So, let's get started. Yeah, so Christy, there has been a lot of different kind of techniques in your specialism. Can you tell us a little bit how you work? What are you looking at? Because we have this beautiful skull here, so enlighten me.
Enlighten you. Yeah, there are definitely different ways how you can treat the teeth. A way what we do and what we will also show you today is with power machine and with electric, with electric machine. The hand pieces are also from diamond disc chips, so that's how we actually take the surface where it's too dominant off. So it's, let's say, a little bit more aggressive. Sometimes people say it's for lazy people, but actually it's really you can really fine-tune with this equipment, and you can work really precise. And when you balance the mouth, it's really important to have the whole surface leveled and that everything can move smoothly together. So by only taking off the sharp edges, let's say with a hand float, you will not make the surface perfectly balanced by making everything straight and symmetrically again.
Is it not possible when you do it because I see also people who doesn't use electric machines, they do it like fully by hand?
Yeah, true. I'm really happy that's how I started dentistry. So I was a hand floater for 4-5 years actually, and a lot of times at night in my bed I was like, I did not do my job well, because it was impossible to go to the last molars, to take big hooks away. So I was never really happy with my work, even when I was educated by somebody who was really famous in Holland. So then I continue my search for how can I become a better dentist, and that's actually how I find the whole balancing system, and it was in America all quite on a high level, and in Holland nobody was really doing it. So I went to America 15 years ago, and I found a really nice personal trainer who learned me balancing. And for me, that was the moment my eyes opened and I knew, okay, this is good what I'm doing now. Now I'm really helping the horse, and not only taking off sharp points, no, taking away pressure of the TMG, making the incisor straight. Yeah, it's totally different. And I do think you can do it with hand floats, but I think it's a hard and difficult job. Yeah. I met one person one day who did it, and I was quite surprised, but I think you need, for sure, also sedation to do a good job, and a lot of strength and a lot of good sharp blades and knowing exactly where you are in the mouth. So it's definitely not that easy to balance a mouth with hands, so we prefer the power.
Because I remember you explained me once, especially for dressage horses, it's very important that the molars, like the last ones, that you do them really well, because when the horse needs to put the head down, the jaw needs to get in front, right?
Correct, yeah.
So and therefore it's important that you do it with the machine.
Yeah,
right?
to balance the whole surface, so to make everything straight in the mouth again, that you have a forward-backward movement.
Okay.
So let's say when you have the head low, the jaw is on the other position than when you have the head more up.
Okay.
So the jaw needs to have the possibility to go up and down, and when you ride also in different positions. That's why you see quite often with some horses, when you put them higher in the frame and the last molar is really dominant, the lower jaw can't go down. So they stay really tight.
Blocked.
Yeah, and they stay blocked and they can get like sensitive in the TMG.
Okay.
So that's why it's for us. And that's not only the last molar, who is really important in that balance, it's also the angle of the front teeth. So when you have your angle from your TMG, going into the incisors, you want the same angle to have the EP forward-backward movement possible.
Yeah.
And in this skull, the angle is quite okay, but later on I will show you a skull with a really steep angle, and then you can see that it's blocking the lower jaw to going forward.
Okay.
So that's really important to keep the whole balance and moving in every direction possible.
What have we got here? This is a 2-year-old, already huge. I already look at it as far as my knowledge goes, then it's already quite complete.
Yeah.
Tell me something about this.
Yeah, it's an interesting skull because it's a 2-year-old, and that's actually the age you guys are starting to select the horses and see if we can prepare them for the stallion show. So also for me, that's the first time when I meet your horses. Last special, which you guys saw, that were the 2-year-olds. So this is a 2-year-old who are just coming from their children garden into the stables.
The kindergarten.
And then the first thing was really important because after a few weeks, months, when they start getting used to handling, they will have the first bit in. Yeah. And we want to make sure that it's like comfortable for them and that not the first time when they have the bit, it's immediately a painful situation. So we will always check if they have wolf teeth, and that's really nice in this one. She shows, because I know it's a girl, she shows on both sides the little teeth in front of the molars, and that's actually where the bit is sitting. And normally, for sure, in the beginning, when we start the young horses, we give them a little bit more bite, maybe a little bit thicker bit to keep it like soft and nicely. So then it will definitely hit the wolf teeth. Also, when they put the bit backwards, it will constantly hit it. So they get too light. So they want to stay too much behind everything, and they don't want to accept a bit. So it's really important that that's the first thing you do. Yeah. And also around that age, sometimes the first molars are starting to shed. And that's
to
quite.
Shed? What's that?
The baby tooth is coming out.
Ah, okay, yeah.
Yeah, and it's the same area where the bit is sitting. So when there's like a tooth half loose, the baby cap, or like not hanging nicely, we can help them taking them off. And of course, we take away all the sharp edges. Yeah. But in the young horses, you won't see a lot of different surface highness. So a lot of balancing we don't need to do. Most of the time.
That was actually one of the questions I received through our Instagram account today, this morning. When do you going to remove the wolf teeth?
I think
Or do you remove them always, or do you say, okay, I can leave it, or what's your opinion?
We always remove them. Because you also never, sometimes people say, yeah, we will never ride the horse again or something, but maybe they sell the horse a year later and somebody else going to ride the horse. So I know a lot of accidents happened because of wolf teeth, because they can rear and they can be really painful on it. So for me, it's really important before the first time you put the bit in, they need to be out. And then you give them like 2 weeks, maybe 3 weeks, some rest that it can heal, and then you can start introducing the bit. So there should be no horse with a wolf tooth and a bit in the mouth. Okay,
very interesting. Because that's also interesting. You can see there is actually a lot of space in here where normally the bit.
Yeah, correct.
So actually we can almost say that horses from nature have the space to wear a bit.
Yeah, you can see that, say that. Even space for 2 bits.
2 bits,
in front of each
Interesting,
other.
actually. I'm wondering who was the first person on Earth who's thinking of it. Like, oh, let's sit on a horse and put a bit in. But actually there is...
At least we have space to work.
Yeah,
that's nice. There's not always so much space. So that's why I think the bit fitting is really
very important
to see how much space there is for the horse and how thick the tongue is, how much tissue. So every horse is really different from each other, how the mouth is shaped. Yeah, here we're looking at the space in the mouth. So below there are the bars. Even sometimes on the lower bars we can find wolf teeth, but that's really rare. But you can also see how small the space is here. So this is actually the area where we have to fit the bit. So together with a lot of tissue, a tongue, you can see that it's a narrow area, and it's with every horse different also. Some are really narrow and some has a lot more space. So it's really individual on every horse. Yeah, and also while they're growing, everything will grow more. So a 2.5-year-old will have a totally different face than when he's 5 years.
Yeah, exactly.
Yeah, here we see the bars. And this is the space between the two upper and lower bars. They're really different from every horse. They can be like sharp or they can be really flat. So also something important to know, if your horse has really sharp bars, what type of bit do we have to put in there? Is there a lot of space?
So here we have another example, another skull, where you can see really well what I just asked with the last molar, if I'm correct.
Yeah.
Show me, because I see already stuff you just explained me.
Yeah, this is a 20-year-old horse, probably even a little bit older than 20, but let's say 20 plus. And this horse never really had dental care. So the teeth just did what they wanted to do.
Okay.
And so it's a really nice example, or actually a sad example, I have to say. You can see that the last molar, maybe you can see it from this side better, I think. This one is like really dominant and really high up, and it blocks the whole jaw, and it even grown into the upper jaw. So even the bone structure changed because of that dominant teeth.
Yeah.
And then when we look at that forward-backward movement of the incisors, you can see in this one, the front teeth are totally blocked. They're like kind of hanging over it. Yeah. So that means that lower jaw, it's impossible. This skull is totally blocked. Yeah. So this horse will have a really hard time raising up in the frame because he can't put the jaw forward. So a good example, but why it's for us so important to balance the mouths and do that like every 6 months, stay on top of them, that they don't go their own way. Yeah, definitely. Okay. Yeah.
So this morning I asked on our Instagram account to send in some questions for Christy. We received some questions. One of the questions from Ronja. How often should the dentist check your 3-year-old horse?
Good question.
Milk to permanent teeth.
Yeah. So a lot happens between 2.5 and let's say 3.5, because they're shedding in every row 3 molars. So that means in total 3, 3, 3, 3.
Okay, that's a lot.
It's 12 molars. So you have a shedding process of 12 molars in a little bit more than a year. So that's from 2.5 till 3.5, let's say almost 4, that they're shedding their molars. And we're learning them a lot on that moment. A lot of young horses are getting taught. Yeah. So I have to admit that my own horses in my own garden, I even look at, in this age, every 6 weeks.
Every 6 weeks?
You can check them. Okay. And you can still find calves who were not ready 6 weeks before, so you should not take them off too early because you also interrupt. So normally we say, okay, between 2 and 4-year-old, at least every half year, but don't look strange when after, let's say 2 months, the horse is maybe a little bit shifting again, because it can definitely be a cap again. So we need to help them shedding them, and So in that time, be really focused on your horse.
Yeah, but
checking.
Yeah, okay, but you can check them yourself. That's easy. Yeah. But
at
people who doesn't have your knowledge, so they need to call someone. At least
every 6 months.
Every 6 months.
At least.
Okay.
Let's say 4 with the young horses.
So we have another interesting question. How can I help my old horse to maintain healthy teeth, and from what age?
Also good question. For sure, the balancing. So it's really important that you balance the mouth, let's say every 10 months, at least for a normal horse who's not really competing, because the competing horses we want to do every 6 months, because we definitely want to stay ahead of everything also with the balancing. But let's say normal, horses for just fun riding, we do every 10 months. And I think when you do that the whole life, you're safe. So you never have to put extra care when they get older, because your basic is good and the teeth will stay good.
But what happens when they are like in a certain age, you don't ride them anymore, you only put them in the field or whatever? Is it still so important? Does it affect the health of a horse? Or?
We think yes, because also it's really hard to give them the same situation in nature. And in nature they can take care of their own horses, because they have really rough hay, they have to break off with or have to cut with their front teeth. So it's so different how we keep them. So even when we keep them as no working horse, you still have to take care of the teeth.
Yeah.
And when it was not been done before, with a lot of horses, we have to even help finding them the right diet, that they can still stay on a good health with maybe teeth who are not good anymore and who also are not fixable anymore.
Yeah.
Because you can imagine the horse we just showed you,
an old one.
It's not fixable. You can make him more comfortable and give him a good diet, but we can't fix it. Yeah.
Okay. So enough talking. Michael's going to show you how they work. But before we're going to show that, if you like our videos, if you like our channel and you want us to make this kind of videos more, don't forget to subscribe.